Hello, and thanks for coming back to the table. The topic today, your health, and how important it is to get the health care you need proactively, not reactively. Jacqueline Glass is the executive producer of the documentary Sistahs Getting Well, and joining us at the table now is Brandi Harvey. She is the co-executive producer of Sistahs Getting Well. Welcome to the show.
Thank you for having me.
Yes, indeed.
Yeah.
And this was really important for you for a number of reasons as well. Let's talk about why the two of you paired up to make this documentary happen.
Well, honestly, Portia, I have been committed to wellness since I was 19 years old. And that's when I began my own health journey. But
what was going on that sparked it for you at 19? Because a lot of 19-years-olds are like, I'm fine, I'm healthy, never have to go to the doctor, right?
I was visiting my father for spring break, and he said, my fluffy girls, and talking about me and my sister. And I said, well, wait a minute.
And to be very clear, I just heard it in the Steve Harvey voice, my fluffy girls. I can hear exactly how that went down.
You better know it.
How did that hit for you?
But you know what it did, and I tell people all the time, it woke up the sleeping giant that was inside of me. Because what it did was it put me on a path of changing the trajectory of my life. And had he not told me that, I wouldn't have got that spark that ignited, that fire of saying that I can take hold of my life and my health.
So sometimes I think the first lesson there is that sometimes it's important to be honest about what we see and what we're doing, and if we can do better, right?
And that's really the goal of this documentary, is for us to be honest about where we are in our own journey. I've known Jacqueline for 16 years now, I think, 14 years. We've been working, I tell her we've been doing the Lord's work a long time, you know,
that's
and
good. It's important work.
We've been committed to transforming not only girls, but women. And so when this documentary came about, it was really a natural progression because it spoke to both of us in our journeys of wanting to not only be well, but see other women well in the world.
Yeah. So for you, I want to bring you back into the conversation, Jacqueline. When you try to narrow down what you're going to talk about in a documentary about Black women's health, there are so many topics we can cover, but you sort of narrowed it down to some basic ones, right? Heart disease, obesity, diabetes, and mental health. Let's start with the heart disease and how that is really impacting women as a leading cause of death in so many states for Black women.
Absolutely. So heart disease is the number one cause of death amongst women, and it is disproportionately affects Black women, heart disease. So it's something that we definitely have to be very cognizant of, what we put in our mouths, what we nurture ourselves with, and more importantly, how we move. We have to move. Movement has to be the medicine that we need. So heart disease is such an important topic that affects us all, and we don't need to look at just National Heart Month, but every month.
Every day, right? Which also ties into obesity, because the two can often be connected, right?
Oh, yeah, absolutely. I mean, America is a very obese nation when we look at the numbers around the world, but primarily Black women in the United States, over 80%, and this is on the CDC's website, you can find it for yourself, that over 80% of Black women are overweight or obese. So that's 4 out of 5. And so when we look around our churches, when we look around our neighborhoods, when we look around our schools, when we look around our communities, we can see that those numbers are real. Right? And so our job here is to now, how do we take control of our health? How do we start using movement as medicine? But also, how do we start to control what we are putting in so what we put out in the world is even better?
Right. I like how you put that, what you're putting in versus what you're putting out in the world, right? Because garbage in, garbage out. That's what we always tell our kids when they're snacking too much. But when we start stress eating, sometimes we stress eating off too, right?
It happens, though. It does. I mean, we don't want to act like we're exempt to that, right? There are things that affect us, and, I want to reach for a little chocolate bar, or I want to reach for a piece of cake or a cookie. But I also know that can't be my everyday go-to.
That can't be the everyday go-to. Diabetes. And Jacqueline, I know this is something that is near and dear to your heart and your personal life experience.
Absolutely. Being diagnosed with type 2 diabetes, I'm told that, you're going to be diabetic the rest of your life. There's nothing you can do about it. You just, pretty much take the medicine. But type 2 diabetes, there is something that we can all do about it. We can change what goes into our mouth. And it's not easy because food addiction is real.
It is.
Food addiction is real. The story I tell when we go out on speaking engagements during COVID, every day I would go to the supermarket and I'd buy 1 pint of Haagen-Dazs ice cream. Every day, cookies and creams, every day until they ran out. And I'm mad. I need to call the store manager because y'all ran out of cookies and cream, ice cream. But it's because I'm going there daily to get the 1 pint of cookies and cream ice cream. So I had to really make some changes and be honest with myself. And once I started putting more produce and plants and live things into my body and walking and doing that 3-mile walk, my numbers naturally came down. I naturally became
How long was that journey for you?
Oh, immediate, like within 3 months. You can make immediate changes and see them within 3 months.
And I love how you said immediate, and that's still 3 months, right? Because some folks are going, oh, that sounds like a long time.
Want 3
but
days.
That's right. But that's the work that it takes. But that's the work that our bodies are worth, right? When you're the mother, the auntie, the wife, the sister, you deserve to put in that work, right?
And our bodies are made to repair itself. Our bodies are just wonderful organs that are made to repair itself. So I say 3 months, but some people can notice changes within weeks. Within a week.
However long it takes, the fact that you're changing. Before we've got about a minute left here, I want to talk about why mental health is such a big part of this issue and the documentary.
Honestly, we're in a real isolation crisis in this country, and we say this in the documentary, don't let Zoom fool you. We are in a connection crisis. And so people are disconnected from community. And what we know is true is that people thrive when they have a tribe. They thrive in community. They thrive when they have people who can support them and hold them accountable. And so that's what we really teach people, that community is key.
That's it. I want to talk a lot more about this when we return, because there's still so many more topics to discuss here. But we also have more that we want to talk about and get another look at the clip from the show. So don't go anywhere. We will be right back. Hey there, Portia here. Listen, that was a good conversation, wasn't it? Want to see the rest of it? Just go to portiashow.com, scroll down until you see that particular episode. But listen, before you scroll on out of here, I need you to do me a favor, please. Like, comment, let us know what you thought of that episode, and subscribe. And if you already are a subscriber, we sure appreciate you. In the meantime, we'll be sure to see you on the next episode of Portia, and you can catch us weeknights on Fox Soul as well. Tell your friends. Tell them to like, comment, and subscribe. See you next time.